Hello, my name is Najimu Akanji. I'm a mental health practitioner student at NKU. I'm going to describe my most interesting client for the week. The patient is a 42 years old African American female patient with a history of generalized anxiety disorder and major depressive disorder, who presented to the clinic for treatment follow-up and medication evaluation appointment. The patient is awake, alert, oriented to place, person, time, and situation. She appears flat and sad, dressed appropriate for age, gender, and setting. She reports that her husband recently filed a divorce against her, and as a result, an anxiety level is going up to the extent that she barely gets 2 hours of sleep in 5 days. She reported difficulty concentrating, low energy, and irritability. The patient reported that her depression is getting worse to the extent that she had to quit her job because she's feeling lonely, irritable, empty, and unhappy about things that she used to enjoy. She reported that her current medications are working, but she would like her medication to be readjusted and evaluated. Her current medications are Solo of 25 mg PO every morning for depression, Buspar 7.5 mg twice daily for anxiety. She reported that she doesn't like to take medicine for insomnia, but right now she would like to have something for sleep. Preceptor and I assessed the patient for suicide and homicidal ideation. Patient denied thought of self-harm and order. Verify with the patient is currently taking any over-the-counter medication to heal sleep or to manage depression. Patient denied using any over-the-counter to manage depression and anxiety. Prescriber and I utilize CSSR to assess patient for suicidal thought and homicidal ideation. Patient denies suicidal thought and homicidal ideation. Verify with the patient if patient have any coping mechanism to manage anxiety and depression. Patient stressed that our coping mechanism is a job, but right now because it's not working, she doesn't have any coping skill to manage her problems. We verify with the patient if she does have any social support system. Patient stressed that her parents, the mom and dad, are social support system, and they promise that they will continue to provide economic and psychological assistance as needed. The reason why this patient case is of interesting is that towards the end of the session, the patient displays subtle behavior towards the prescriber by making seductive compliments toward the prescriber. The patient stated that, "Thank you, doctor. You are such a good-looking gentleman. I don't know if you are married or not because you don't have a ring on you. Can I have your number? Maybe we can chit-chat later." The prescriber professionally replied to the patient that the goal of the meeting was to help the client overcome her challenges, and that should be the goal of the encounter. The patient verbalized understanding of the prescriber. She said, "Thanks, okay, doctor, I got you." The prescriber informed the patient that he understands the patient's challenges and stressed that creating a fear with the client is unethical, unacceptable, and unprofessional behavior that could jeopardize treatment outcome and breach the client and patient professional relationship. The preceptor proceeds with evaluation of patient medication. A few changes were made to the medication. Prescriber order Solo 50 mg PO every morning for depression. Encourage patient to continue taking Buspar 7.5 mg twice daily for anxiety. Also, prescriber order Trazodone 50 mg PO at bedtime for insomnia for the patient. The preceptor discussed indication of Trazodone, risk, benefit, and reported side effect of the medication. Patient verbalized understanding of TTT. We strongly encourage the patient to engage in moderate exercise to promote sleep and to manage a depression. Patient verbalized understanding of TTT. In conclusion, to promote patient safety and treatment adherence, mental health care provider should maintain a client and provider therapeutic alliance that promote trust and dignity, and they should never exploit patient for any advantage or for personal gain, which may lead to treatment failure and illegal lawsuit against the provider. Thanks for listening. Bye-bye.